Cuprimine is used to treat rheumatoid arthritis, Wilson's disease, and a disorder that causes kidney stones. For rheumatoid arthritis, it helps to decrease pain, tenderness, and swelling in the joints. For Wilson's disease, it binds to copper and helps remove it from the body, improving liver function and mental/mood/nerve problems. For cystinuria, it helps decrease the amount of a certain substance in the urine that can cause kidney stones. The daily dosage and optimal timing for taking Cuprimine should be determined by your doctor based on your condition. When taking Cuprimine, make sure to take it on an empty stomach, either 1 hour before or 2 hours after meals. Also, take it at least 1 hour apart from other medications, especially antacids, milk, or food. The dosage of Cuprimine will depend on your medical condition and how you respond to the treatment. It's important to take it regularly at the same time each day to get the most benefit from it. Your doctor may also instruct you to take vitamin B6, pyridoxine, and iron along with Cuprimine. Be sure to follow your doctor's instructions carefully, and if you need to take iron or other mineral-containing products, take them at least 2 hours before or after taking Cuprimine. For the treatment of rheumatoid arthritis, it may take 2 to 3 months before you see any improvement in your condition. For the treatment of Wilson's disease, it may take 1 to 3 months before you see improvement, and your condition may even worsen at first. For the treatment of cystinuria, be sure to follow the recommended diet by your doctor and drink plenty of water unless directed otherwise. If you don't see any improvement in your condition or if it worsens, make sure to inform your doctor. Some common side effects of Cuprimine may include stomach/abdominal pain, nausea/vomiting, loss of appetite, diarrhea, and decreased sense of taste. These side effects should be reported to your doctor or pharmacist if they persist or worsen. It's important to remember that this medication has been prescribed to you because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as signs of infection, easy bruising/bleeding, coughing up blood, shortness of breath, skin blisters, mouth sores, new or worsening joint pain, thinning/wrinkling skin, signs of kidney problems, muscle weakness, eye problems, or signs of liver problems. A serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Remember to discuss any concerns or questions with your healthcare provider. As for the optimal timing and dosage, it's important to follow your doctor's instructions carefully. They will determine the best dosage and timing for you based on your individual needs and medical condition. Be sure to take Cuprimine exactly as prescribed, and do not adjust your dosage without consulting your doctor. Before taking Cuprimine, it's important to let your doctor or pharmacist know if you are allergic to it, penicillins, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's crucial to discuss this with your pharmacist. Also, inform your doctor or pharmacist about your medical history, especially if you've had a severe reaction to penicillamine in the past, have kidney disease, or blood/bone marrow disorders. If you are planning to have surgery, make sure to tell your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor as well. You should not become pregnant while using Cuprimine, as it may harm an unborn baby. However, in certain situations, such as treating Wilson's disease, it may be used during pregnancy. If you become pregnant, talk to your doctor right away about the risks and benefits of this medication. It is not known if Cuprimine passes into breast milk, so breastfeeding is not recommended while using this medication. Be sure to consult your doctor before breastfeeding if you are using Cuprimine. Make sure to consult your doctor about any potential drug interactions before taking Cuprimine. It is important to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Cuprimine include digoxin, gold salts, such as oranophine, drugs to treat malaria, such as chloroquine, phenylbutazone, other drugs that decrease bone marrow function, such as azathioprine, cancer chemotherapy, trimethoprim/sulfamethoxazole. Always consult your doctor before starting or stopping any medications. If someone has taken too much Cuprimine and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. It is important not to share Cuprimine with others. While taking this medication, it is important to have regular lab and/or medical tests, such as complete blood count, hematocrit/hemoglobin, liver function, urine test, and physical exam. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Cuprimine, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Don't take double the dose to make up for the missed one. It's important to store Cuprimine at room temperature, away from light and moisture. Avoid storing it in the bathroom, and always keep it out of reach of children and pets. When it comes to discarding Cuprimine, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly dispose of this medication when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal of Cuprimine. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.